Hey guys, welcome back to my channel, which is Real Homeopathy. So today in this class I will be explaining on clinical anatomy. So anatomy is the basic subject of all the medical students, and it comes in the first year of your medical colleges. And if you really want to know what is important in the clinical anatomy, then stay tuned till the end, and let's begin. Firstly, there is introduction, there is subdivision of anatomy, there is a history of anatomy and language of anatomy, systems of anatomy, clinical anatomy, and there's a points to remember, and also there is a MCQs. There are certain things like nervous system, skin, limbic system or the lymphatic system, circulatory system, that all will come. So let's begin from the introduction of clinical anatomy today. So that is the Chaurasia. I'll be showing you the book. So this is the BD Chaurasia book which you will be using for clinical anatomy. And as we begin, what is the introduction here? So human anatomy is the science which deals with the structure of the human body. Once you come to the first year, you have to start making notes. I'll give you some tips what you have to do, and watch till the end to get all those tips to your first year exams. And once you start beginning the first year of your examination, you have to understand and you have to study from the first year. Once you pass out from your PUC second year, write the CET or the NEET exams, then you come to the anatomy year, the first year medical class, and you start to reading anatomy here. You'll attend the classes, but you have to focus from the beginning of the medical degree. So firstly you have to start making notes which I'll be saying you, and firstly you have to understand the introduction of this anatomy. So you have to understand what is anatomy. So anatomy is the science which deals with the structure of the human body. So whatever comes in the human body, which is like the skeleton, muscles, arteries, veins, the organs will all come under the anatomy. Okay, so this is the science which deals with the structure of the human body. So this is the term which is derived from a Greek word anatome, meaning cutting up. So means cutting up. The term dissection is a Latin equivalent of the Greek anatomy here. However, the two words which is anatomy here and dissection are not synonymous. What is dissection and what is the anatomy? They are not synonymous. So dissection is a mere technique. Once you come to the practical anatomy or the clinical anatomy, then you will understand what is the dissection here. Whereas anatomy is a wide field of study. Anatomy forms a firm foundation of the whole art of medicine and introduces the student to the greater part of this medical terminology. So anatomy is to physiology as geography is to history. Okay, again there are subsections of anatomy. So like cadaveric anatomy, the first one is a cadaveric. Living anatomy, embryology anatomy, which is a developmental anatomy here, and also histology, surface anatomy, graphic and imaging anatomy, comparative anatomy, physiologic anthropology, and applied anatomy, experimental anatomy, and genetics. So these are the 11 types of anatomy. And what is cadaveric anatomy, you will read it by yourself, and in the brief I'll be saying you. So these are the 11 subdivisions of anatomy here. Let's directly jump into the you read these types. And let directly jump into history of anatomy. Is also the Greek period is there, Roman period. I think this is not all needed. History of anatomy is not an essential here. Even anatomical nomenclature of clinical anatomy is not needed. Even language of anatomy is and has to be understood, because what is prone position, what is supine position, what is lithotomy position, and these are the positions that you need to understand. There is a median and sagittal planes. So what are these planes? Coronal and horizontal planes. In order to understand the anatomical terms, you have to understand this language of anatomy. Firstly, we will begin with the anatomical positions here. When a person is standing straight with eyes looking forwards, both arms by the side of body, palms facing forwards, both felt together. So this is anatomical position of the person. Okay, supine position. What is supine position? When a person is lying on her or his back, arms by the side, palms facing upwards and feet put together, the position is supine. Next, coming to prone, person lying on her face, on the chest and abdomen is said to be in the prone position. This is the prone position. Lithotomy position, person lying on back with legs up and feet supported by the straps. This comes in the delivering of the baby. In females it is seen, the lithotomy position is seen in the females. So this is the term you need to understand, lithotomy position. And next, coming to the planes. So what is median and mid sagittal planes? Sagittal planes, coronal plane, horizontal or transverse plane, oblique plane, cardinal plane, fundamental plane, center of gravity. So these all are the essential ones, planes. What is dorsal? What is medial? So these are the terms you have to understand. What is posterior, what is anterior, what is superior, these are the terms you have to understand here. In upper limb you have to understand the body movements. So what kind of body movements you have to understand? There is a gliding movement, angular movement, spatial movements and rotation. It is a circumduction, medial rotation, lateral rotation. This all you will see in the rotations. Coming to the upper limb, which is the arms or the hands, you basically say this is the upper limb, we say in anatomy. So what is flexion? When two flexor surfaces are brought close to each other. Example, in elbow joint, which is the elbow joint, when front of the arm and forearm move close to each other. So this is the flexion, which is straight, flexion, extension. So that was the flexion position. Next, coming to the extension. When extensor or dorsal surfaces are brought in as much approximations as possible. When extensor or dorsal surfaces are brought together in as much as approximation, then that is called as a extension position. Okay, abduction of shoulder, when limb is taken away from the body, that is abduction. Adduction of shoulder, when limb is brought close to the body. And flexion of shoulders, if arm is taken towards the front of the chest, then
shoulder
that is the flexion
abduction,
of the shoulder. Extension, arm is taken backwards and laterally, so that is extension. Circumduction, I said this is the word, so you will understand, you have to understand. If you don't understand these terms, then it will be very difficult for you to write the examination, and it is very difficult for you all to understand the basic parts of the body and the movements of the body, in which as you will have to understand for the next year. So this will be the basic of everything. Okay. you have to must and understand these terms like circumduction, extension, flexion, abduction of shoulder, abduction or adduction, abduction. Just understand what is abduction and adduction. In the Viva, there will be practical classes, they will be explaining what is abduction, what is adduction. So, this will be the random question in the Viva which is asked by the examiner. Next, medial rotation of a shoulder. When the arm rotates medially, bringing the flexed forearm across the chest. So, this will all be the lateral rotation. Then supination, pronation, and the palm face backwards or down. This is a pronation, supination. Okay, abduction of the fingers. When all fingers get together, adduction of digits of fingers, abduction like this of the fingers, adduction and abduction. Opposition of thumb. When the tip of the thumb touches tips of any other fingers, this one is the opposition of the thumb. Okay, opposition of the thumb. I'll be posting all the images, you will just understand that. Coming to the lower limb, it will be the same and it will be the lengthier video, and I don't want to make that lengthy video. And in lower limb also it is similar, but it depends on the joints like hip joint, knee joint. Depending upon the lower limb, there is flexion of thigh, extension of thigh, abduction, adduction, medial rotation, lateral rotation, circumduction, flexion of knee, extension of knee, dorsiflexion of foot, plantar flexion of foot, inversion of foot, eversion of foot. What is flexion of a thigh? When a front of a thigh comes close to or in contact with front of abdomen, that is the flexion of thigh. Extension of thigh. When persons stand erect, this is extension. Abduction, when thigh is taken away from the median plane, then that is a abduction. Adduction, when thigh is brought close to medial plane. Medial rotation, when thigh is turned medially, it is done by pointing the big toe medially. Okay. When thigh is turned laterally, it is done by pointing the big toe laterally. Circumduction, flexion, adduction, extension and adduction, abduction are done in sequence. So, that is the circumduction. Next, coming to the flexion of knee. When back of thigh and back of leg come close to or in opposition. So, this is the flexion of knee. Dorsiflexion of foot, when dorsum of foot is brought close to front of leg and sole faces forwards. Plantar flexion of foot, when sole of foot or plantar aspect of the foot faces the backwards. Inversion of foot, when medial border of foot is raised from the ground. Eversion of foot, when lateral borders of foot is raised from the ground. So, these are the points you will be understand in the lower limbs. I'll be loading the pictures in neck and trunk, lateral flexion of neck and trunk, opening the mouth, that is the mandibular depression, opening the mouth. Mandibular depression. Closure of mouth, it's a mandibular elevation. Okay, depression, elevation. Protraction of lower jaw. Protraction. Retraction means taking it back. This one is a section of that.